Hi, I'm Dr. Diluni from Mulgrave Dental Group, and today we're going to talk about teeth tartar, which some of us talk about but don't really understand. So what is teeth tartar? So teeth tartar is bacterially infected calcium deposits that build up over time around our teeth. So usually most people have it built up every 6 months. A small proportion of people every sort of 3 to 4 months, and it usually happens because our saliva has calcium in it. So this calcium gets inevitably deposited around our teeth, and then the bacteria love these calcium deposits and they come in and sit in that calcium deposit and infect the calcium deposit. So pretty much these tartar are full of bacteria and the bad bugs. So if they sit too long in our teeth, what happens is it starts eating away the jawbone that our teeth are sitting in, and gradually our teeth start to get loose in the jawbone because the bacteria is eating away at the jawbone support, and eventually the teeth will fall out. Well, the tartar is almost like barnacles on the underside of a boat. The old tartar that's very hard, you can be brushing all day long and it won't come out. So you need to go see a professional every 6 months, or sometimes if you build it up more often, every 3 to 4 months, to get the tartar professionally removed. But you can reduce the buildup of the hard tartar by carefully brushing and flossing at home. Even after good brushing and flossing, we see some patients build up this tartar very quickly, and it's very important that these patients go and see a dentist or their hygienist very often, usually as a maximum every 3 months, sometimes every 6 months, so that they can remove these tartar, because if you leave the tartar there, it will actually cause gum disease or periodontal disease that can progress to eventually the teeth becoming mobile or loose and falling out. I hope this has answered your questions about teeth tartar. So if you notice any tartar, or sometimes tartar can't be seen, it needs to be picked up by the hygienist or on the x-rays. So go to your next dental checkup and ask your dentist all about it.